Good morning, guys. We are going to give it another minute to let folks join. So thank you for being here. Good morning, everybody. Thank you so much for joining. My name is Emily McEver, and I am the Director of Sales and Marketing at Manor Lake Assisted Living and Memory Care in Gainesville, Georgia. And first, I just want to thank Keith Knabb and Affordable Medicare Solutions for partnering with us on this important update. You will not be disappointed. Keith is an excellent presenter, and anytime I have been able to host him, I have done it, whether it's been a support group or a resource group or family night or what have you. So I'm excited to be here with Keith this morning. And a little bit more about Manor Lake. We have 3 other locations: Athens, Bridge Mill, and Hiram. And we are breaking ground in Dawsonville, Ellijay, and Houston. And I am so proud to be a part of this company, this Manor Lake family. We have gone through great lengths to keep our older adults safe, and through several measures, some of which being that we are screening all employees and all residents 3 times a day with not just temperature, not just with temperature, but with oxygen levels. Anytime the National Guard has offered to come and help clean, we have taken them up on that offer. We have our housekeepers stretched over, they're here 7 days a week, and they are constantly sanitizing and wiping things down, keeping everyone safe. We are accepting new residents, and we are requiring a negative COVID test close to that admission date. And then we also do a rapid test once they're here. So I'm just, again, excited that we are a COVID-free community. We have had 0 cases in staff or residents, and that's not just in Gainesville, but it's at our other locations. And so I'm just so thankful for this company and how they have fought to just constantly update us and that kind of thing. And now I know our families are anxiously waiting for visiting restrictions to be lifted, but they have been so kind and supportive as we have just fought to keep their loved ones safe. So, and we're keeping that connection open with FaceTime and outside visiting socially distanced with PPE on. So now Keith is going to introduce himself, tell you more about Affordable Medicare Solutions. They are a wonderful business partner. They are a free resource for you guys to use. So Keith, take it away.
Thank you very much. I'm glad to be here today. Affordable Medicare Solutions is the largest provider of Medicare education services in North Georgia. And this has been great to switch over to Zoom and have virtual training. I have taught in every major hospital in Georgia, North Georgia, and I've also taught at senior centers and churches, but none of that's happening right now. We're all being asked to do things virtually, and it's pretty effective. So we are going to record this event today, so it will be shared on our YouTube channel, and it will also be shared through our social media platforms. So I really do appreciate Manor Lake and Emily for inviting us. My staff is a staff of 9 individuals that are fantastic at serving families and seniors on an ongoing basis with their Medicare needs. So Medicare is not set it and forget it. Medicare is something you manage as your situation changes. So if you move to an assisted living home, that's an opportunity to manage your Medicare. Also, at the end of each year during the annual enrollment period is a great time to manage your Medicare. So today I'm going to share my screen, and we're going to talk about Medicare and the coronavirus, COVID-19. So let's get to the presentation. So today we're going to talk about Medicare and the coronavirus. Again, my company is Affordable Medicare Solutions. We're in Gwinnett County, Georgia, but serving all of North Georgia. So this is what's going on. We have 2 interesting terms, SARS-CoV-2 and COVID-19. Now, COVID-19 is the virus. SARS is a severe acute respiratory syndrome brought on by that virus. So if you think about AIDS and HIV, it's very similar. AIDS is a syndrome, and HIV is the virus. So the world is experiencing this once in a 100-year virus pandemic. And of course, Medicare and the Medicare programs have responded very quickly. There's been some neat changes that have helped out our Medicare members. But let's do a quick review because Medicare is different than other health insurance. And let's talk to make sure everybody understands that Medicare is not monolithic. It's got two different ways to access the Medicare benefits. There's a traditional method, and there is a new modernized method that's been around since 2005. So these paths to access are very important to understand. And we have a Medicare ebook that explains this. We also do educational flyers and educational classes on this topic. But basically, with traditional Medicare, you get to prepay for your medical events by purchasing a small, simple insurance policy called a Medicare supplement or Medigap. It lays silently in the background. It doesn't interact with your doctors, but it pays the rest of your bills so you don't get any big bills in a medical event. With modernized Medicare, you do that differently. You'll pay as you go along, so you'll pay co-pays, not deductibles, but co-pays for each service that you need. But also with modernized Medicare, you're going to get a lot of extra benefits. If you've seen Joe Namath on TV recently, he's talking about get your extra Medicare benefits. So the coronavirus, which is really a family of viruses. Coronaviruses, there's thousands, tens of thousands of different coronaviruses, but this coronavirus is a new one, and it started in Wuhan, China. And what makes this one really, really different is that it can incubate in your body for up to 21 days. But the typical time that it incubates before you actually know you're sick is about 5 days. But still, that's a dangerous period because you don't know that you're sick. You're feeling great. You're out working in the yard. You're going visiting your grocery store everywhere, and you don't know that you're actually spreading this virus. So it's very important. And this is what the governor of Georgia said day before yesterday and other authorities, that it is very important to wear face coverings in public or while near others. You don't need to wear it while you're hiking in the mountains or while you're working in your yard, but you need to wear it if you're going to the store and if you're going out to other activities. So here's the symptoms. And my own daughter had these symptoms. Luckily, she tested negative, but they had an outbreak in her office. She had headache. She had the cough and this tingly sore throat. She did not have a fever, but most people will have a fever, but a general feeling of unwell with body ache, and also flu and pneumonia symptoms in some people. But what's really been interesting about this virus is that people are losing their ability to taste and to smell. Smell and taste are very intermingled. And this is actually now being found to be the most common way that you have a sign that you need to get a test for COVID-19. If you lose your ability to taste or smell, that's the biggest sign right now. So this asymptomatic spread is confusing to people because there are people who will never develop symptoms, and there are also people that are just getting ready to start having symptoms, so pre-symptomatic. But about 30 to 50% of the viral spread is from these individuals, and it's very typical that it's within your household or close coworkers. So that's what's happening, and you may have heard of the family of 18 people that had a surprise birthday party, invited their 80-year-old grandparents to be there also. The mother didn't go. She's a doctor. She said, heck no, I'm not going to your party. But 18 people have gotten sick from that birthday party out west. And that's how it happens. And 80% of these infections are going to be mild or maybe never even have a symptom. But 15% are severe that require oxygen, and about 5% are critical, which means you actually could have to go on to ventilation therapy. Now, here's the facts right now. And we're having a lot of cases. Of course, our testing is going through the roof, and we've had over 122,000 deaths. But in Georgia, we're doing right at 71,000 cases so far, and we've had a massive increase in testing here in Georgia. We have 2,745 deaths. But what is to be expected is it's going to take about 2 years for the virus to run its full course unless we have a miracle vaccine. If we get a vaccine, which we've never created one for any coronavirus, but if we get a vaccine, it would be fantastic. And 100 candidate vaccines are being researched, and about 12 so far have made it into the second stage of testing. And that's good news. Maybe we'll get 1 or 2 by the end of the year. That would be the fastest a vaccine has ever been created. And this virus is many times more dangerous than seasonal flu. There's been a lot of arguments on that, but those have all been put aside. There is no comparison on this virus to the seasonal flu. So this is what we've learned. The really great thing about doing the lockdown is that it did what it was supposed to do. From April 10th until June 10th, we experienced flattening the curve. We experienced tamping down the virus. And that gave us a lot of time to understand who gets affected by this, to help the hospitals be best prepared, and also to help people to understand in their own families how to behave properly. And we did learn that children, in a rare case, will get affected by this. Not very often, but children do. I think we've had 11 young people die in Georgia also. But also we learned that ventilators may have been, and probably have been, overused. They thought this was more of a respiratory disorder, and that's what the coronaviruses usually are. But most people who get on a ventilator were passing away. But now they're using new therapies such as dexamethasone, which is a way to treat people that are on a ventilator, and they actually get, I think it's a 30% reduction. And so these are new things that we've learned because we've had 2 months of being able to study this. What we've really learned, though, is this virus is more about inflammation of the arteries. It creates blood clotting. The arteries get inflamed and they get irritated and they start releasing blood clotting factors. So immediately now people are being put on blood thinners, and this is one reason why our death fatality rates are going down. And this took a couple months to learn these things. But it's some other things we've also learned, and you need to talk to your doctor before you take any vitamins, but we've learned that vitamin D3, vitamin C, zinc, they all help in this circumstance. And they're also very benign. These are things that you should probably be taking anyway as you get older. So every day I have someone say to me, hey, Keith, you know, the cases are going up only because we're testing. Well, let's talk about what that really means, because there's a lot of confusion by the general public on this, and a lot of, unfortunately, talk radio hosts and things are kind of manipulating this a little bit. But New York just did 57,000 tests, and they had only a 1% positive rate. That's amazing. Georgia is at 10% positive rate, and Florida is at 12%. Arizona is at 20% positive rate. So it really does vary quite a bit. And when you get to those higher rates, that means that you're having community spread. Arizona has 3,000 cases yesterday. Texas and Florida both were over 5,000, I believe, and California also. So there are places that are having community spread. Here in Georgia, it's kind of looking like that a little bit, but really, if we would wear our face mask and do our social distancing, we would do much better than 10%. The national average right now is at 8%, and it was earlier at about 5%. So as we've opened up, these numbers have gone up. So let's talk about Medicare. Medicare instantly right away said the lab tests for COVID-19 will be free. You do not have to pay anything for those tests. Your doctor orders them, you're set. And when your doctor has the antibody test, which the doctor should have those on hand now, those are also tests at no cost to you, as long as they are FDA authorized. There's a lot of junk antibody tests on the market, so make sure you're using the FDA authorized versions. Now, medically necessary hospitalizations, of course, are covered for this, but some of the plans are actually waiving the hospital costs. And also, if you have to stay in the hospital longer because you have COVID and can't find a place to stay due to quarantine reasons, they'll also pay for that. Now, once we get a vaccine for COVID-19, Medicare has already said that one or more of those vaccines will be free, and there'll be no charge, and they'll be part of the normal vaccination schedule. So that's good proactive actions for Medicare. Also, some great proaction. A couple of years ago, Medicare tested out telehealth in the rural areas. Well, last year in 2019, they expanded it to all of America, but now this has really been great that most people have been utilizing telehealth when possible to see their doctor. If the doctor says, no, I need you to come on in, then you go on into the doctor. But I did my own telehealth visit a month or two ago. I had my blood pressure cuff, I had my thermometer, I weighed myself, I gave them all the things, and the nurse said, fantastic. So she said, this was a good visit, and I took care of everything I needed to that day. You should also make sure if you've got a Medicare Advantage plan that it may have additional benefits for you that you can take advantage of, such as over-the-counter medical items shipped to your home so you don't have to go to the store. Also, the fitness programs, they've been doing online fitness programs for free, and so that you can do that, your workouts from home. The governor of Georgia did a great thing. Governor Kemp rushed through that, allowed people to get their early refills on drugs, up to 90 days refill, unless it were controlled substances. So very good there. You should pay no fees for the testing and no fees for the drugs to be delivered to your home. And the last thing that's really interesting is that Medicare also had a 3-day hospital stay rule under traditional Medicare. Original Medicare said you had to stay in the hospital 3 days in order to qualify for skilled nursing rehabilitation. They have relaxed or suspended that rule so you can get out of the hospital quicker to free up beds in case the hospitals need those beds for other patients. Very smart move, and that's going to be necessary in several states coming soon. All of this has been very stressful. There's no doubt. And senior isolation is very stressful. Seniors being isolated. So what can we do to help reduce this stress? What can we do to get through this together to help each other out? Well, one of the things to do is to probably get away from the news and get away from crazy social media and people arguing and things like that. Go out and read a nice book or go out and stretch or meditate. Unfortunately, alcohol sales have gone up 50%, so it'd probably be a good idea not to pick up that glass of wine and make time to connect with others. My family has been doing Zoom birthday parties and Zoom family nights, playing games. You can connect with long friends you haven't seen in a while by Zoom, or you can just call them on the phone. But talk to your doctor. Many of the Medicare plans are now offering free virtual and telehealth mental health services, so that if someone is feeling very stressful or if they've lost a loved one and need grief counseling, they can do it over the phone or over the virtual telehealth visits. And those are free. Now, on top of the stress, there's also scammers, people out there that want to scam people and get their Medicare number or their personal information. Of course, they want to steal money. So just protect yourself and protect your parents, protect your clients. There have been robocalls offering people free respiratory masks. There's social media fraudulent posts asking for donations to charities that aren't true. I think Facebook canceled about 100 million different ads. It was crazy. Fake testing kits and fake offers for protective equipment. Stock market. There's been stock market deals that people have been trying to get swindled into about the latest cure, test, or vaccine. There's also been emails, fake emails saying they're from the CDC or the World Health Organization. But a new one that happened recently are text messages saying, please contact us because a person you know has COVID-19 and we're doing a simple contact trace. And it has been a scam. Be very, very careful before you respond to any things like these. For example, Medicare will never contact you or ask you unless you've given them permission to call you. They're never going to call you from Medicare to sell you anything. They're not going to come visit you in your home. And Medicare cannot enroll you over the phone unless you call it first. That's why you need to deal with a professional Medicare resource like ours to make sure that you're not dealing with some fly-by-night situation. This is a fun one, conspiracy theories. And man, I've seen a lot. And some people that I really respected have subscribed to a couple of conspiracy theories that are a little bit crazy. One of them is called the Plandemic video with a discredited doctor. So please don't share that. If you see friends sharing that video, it's been debunked and she has been discredited. Masks. Masks won't activate the virus in you. Masks are not bad for you. Of course, don't wear a dirty mask. Make sure if you have multiple washable masks that you are washing them. But another thing is that people think that we are overcounting the deaths related to COVID, and that's not true. They have documented for sure that there is an undercount, not just in the United States, but worldwide. And I'll give you an example. my good friend from college lives in Nicaragua. And if you go look at the website for Nicaragua, they say they've had 60 deaths from COVID. And he just about fell off his chair laughing when he and I were talking the other day. And he said, no, we've had over 10,000 unusual pneumonia deaths, atypical pneumonia deaths. And so the government of Nicaragua was lying. And of course, there's been lots of other undercounts, and a lot of places just don't even have enough testing. So we're definitely not undercounting. 5G cell phone towers, they don't cause COVID. Vaccines, of course, are good for you and for society, and they have vastly improved our world. And of course, no one can force anyone to take a vaccine in the United States. So here's what some Medicare carriers have been doing. And this varies by carrier. So if your parent or yourself, if you have a Medicare plan, you need to call your carrier. But almost all of them are waiving the out-of-pocket costs right now for primary care. Some of them are waiving the costs for specialists, behavioral health, and telehealth for at least part of 2020. Some have announced all the way through the end of the year. Also, some of the Medicare carrier insurers have gone back to March and reprocessed old claims for members who had already paid their doctor, and they're refunding them the money. That's pretty cool. One of our carriers is actually sending out free safety kits with 2 washable face masks. I think every one of the carriers should be doing that, and they probably put their logo on the front of it, so it's probably can write it off as an advertising expense. Some of the Medicare supplement policies have announced that they are going to give price stability and support to make sure that there are not any radical changes to the premiums because of COVID. And not every one of them has said that, but 2 of the major ones have made announcements about that. Also, for a couple more days, we have a special enrollment period that was extended from March 31st to June 30th for people who are in the Medicare HMO or PPO plans. If they're in a plan that is not working for them, they're allowed to change for a July 1st effective date. And that ends on June 30th, unless they decide to extend it. And we've not heard any news about that. So we're nearly finished here. And this is important that you go to proper resources. Make sure that you're looking at good information. So we've got great information at our website, amsplans.com. The CDC has got pretty good information posted up. For Medicare, even better than the Medicare website, which is medicare.gov, is the website medicarerights.org. So they will actually research questions for you. They will answer questions. They have volunteers and professionals that will help you. So we rely upon medicarerights.org because sometimes when you call Medicare, you don't exactly get the right answers that were thorough enough. And so you can get even more information there. Also, the Department of Public Health, dph.georgia.gov, they do a daily update, and they've been doing a very good job lately. They had some problems in the beginning, and rightfully so were criticized, but they've actually been doing a pretty good job. So a lot of the information today was brought from the Department of Public Health, but there are many other good websites that have good information on what is going on in the United States, each state, as well as your counties. So the Gwinnett Department of Health also has some good information there in my county, in Gwinnett County. So we're going to turn it over to questions. And also, if you look in the chat box, there's information that's there. You can reach out to me, Keith Knabb, at Affordable Medicare Solutions. You can reach out to Emily McCord at Manor Lake. You can also request this slideshow or other information by emailing Raquel at amsplans.com. You can see all of this in the chat box. And we'll also post this on our YouTube channel. And unfortunately, because of the nature of this virus and how rapidly things change, we're probably going to have to update this video in about 2 weeks. Thank you very much for attending. And please, if you haven't had a chance to hear about Manor Lake and their 3 new locations that they're expanding, they've got a lot of great news to share. So please contact Emily. Thank you very much. Do we have any questions, Raquel?
No questions at this time.
Thank you very much for attending. We're going to end the presentation now.